We've all seen the Medicare ads where the plans are advertised at zero premium and all kinds of perks. But what they don't tell you is that if you have some kind of an illness, it could cost you up to $10,000. Let me explain. When a person is ready to go on Medicare, they will quickly learn that there are two different systems, two different ways in which we can use our Medicare benefits. There's not 10, there's 2. And so when you go on Medicare, you have to choose which one of these systems is going to be a good fit for you. And so I'm going to do a quick review of those two systems. One is to stay in what we call original Medicare A and B. Okay, this is a system that actually began in 1965. When a person stays in original Medicare, what that means is that Medicare is going to be the first payer. So anytime they would see a doctor or go to the hospital, they're giving their Medicare A and B card, and Medicare is going to pay first. Now, Medicare pays pretty decently, but it doesn't pay for anything 100% other than preventive services. So in this A and B system, what we have is we have gaps, financial responsibilities that you would be liable for. So on the A of Medicare, we actually have 3 gaps. And on the B of Medicare, we have 3 gaps. Now, the difference between A and B is this. Everything that is A related has to do with inpatient type services. This would be hospital expenses as well as skilled nursing expenses. So again, we're admitted to a facility. It is the A of Medicare. That system is going to pay the bills. The B of Medicare is the outpatient side of Medicare, as well as all doctor related services. So those doctors are paid to the B. That could be whether that's an inpatient service you receive from a doctor, a surgeon, an anesthesiologist, a hospitalist, an ER doctor is going to be paid through the B of Medicare, even if you're in the hospital. The B also is going to pay for doctor visits and specialist visits that you would be making. So A is inpatient, B is going to be outpatient. So again, we have 3 gaps. So just a quick review on the gaps. What we mean by the gap is you're responsible for this out-of-pocket expense. And so if I go to the hospital, that means I'm using my A of Medicare. And so this year I have a deductible of $1,600. $1,600 deductible. And the deductible simply means that you have to pay that deductible, and then Medicare will pay after that. And that deductible is all you have to pay for up to a 60-day stay in the hospital, which is 99% of every situation. However, if someone's really ill, really sick, and they're in the hospital longer than 60 continuous days, then that takes us to our second gap in Medicare, and these are copays to the hospital. And these range anywhere from $400 a day up to $800 a day. So these are daily copays, $400 to $800. $400 a day for month 3, month 4, and month 5, or $800 on a daily basis. Okay, that's our second gap. And then the last gap is for skilled nursing facilities. So this is someone that's had a stroke, maybe a hip replacement, and they're going to a facility for rehab. And so here's the way it works. Medicare says the first 20 days in the skilled nursing facility doesn't cost a Medicare recipient any money as long as they had a full 3-day hospital stay prior to going to skilled nursing. And so as long as we had a 3-day stay, first 20 days, Medicare pays everything. After that, I have another 80 days of coverage, days 21 to 100, but I'm responsible for a daily copay of $200 a day. Okay, and so the A of Medicare has these gaps: a deductible, copays for extended hospital stays, and copays for extended skilled nursing stays. Now that takes us then to the Part B. Part B again is that outpatient side, the doctor services of Medicare. We also have a deductible on the B side, and for 2023, that's $226. And so you'd be responsible for the first $226 for anything that's going to the B side of Medicare. After that, then Medicare is going to be an 80-20 plan. You would be responsible as a Medicare recipient to pay that 20%. Either you pay out of pocket or you get insurance to cover that. And then the last gap on the B is called an excess charge. And what this is when a doctor adds 15% to the bill. And there are doctors that will do this. Right now, about 1 out of 10 doctors add to the Medicare bill. And so in other words, they won't take Medicare reimbursement rates as payment in full. When they add to the bill, they add 15%. And you, being the Medicare recipient, would be responsible to pay for that. So my whole point is we have 3 gaps on the A and we have 3 gaps on the B of Medicare. You're responsible for those financial gaps. So the majority of people that stay in original A and B don't want that kind of liability. So what they will do is they will get a Medigap policy, Medigap, to again fill in these gaps, depending on what plan they buy. These plans are also called Medicare supplemental plans, so that's all the same. And so again, there's 10 different options. I'm not going to go into all those. I'm just going to tell you about the top 3 plans today. Most people are buying an F plan, a G plan, or an N plan. Now, the F plan is a full coverage plan. It covers all 6 of the gaps. So if someone has an F plan, they should never, ever get a bill. Now, the problem with the F plan is that in order to have an F plan today, to buy one, you actually had to be born before January 1st, 1955, having been eligible for Medicare prior to January 1, 2020. So if you're born before 55, eligible for Medicare before January 1, 2020, you can still buy an F plan. All right. Now, after that F plan has been basically is going away, what's happening is the G plan has now replaced it in popularity because most people can't get an F plan. But those that are born after January 1st, 55, starting Medicare after January 1, 2020, the G plan is the plan most are selecting, and it covers 5 of the 6 gaps.
If you're watching this video, that means that you probably have some decisions about Medicare that you're going to have to make. We upload 3 videos every week so that you'll have the information and the education that you need to make right Medicare decisions and avoid getting stuck with penalties and bad coverage. To make sure that you don't miss out on any of these crucial topics, click the subscribe button below, then turn on notifications. Have a blessed day.
So the one gap that G doesn't pay is the Part B deductible. Part B deductible. And again, that is once a year. And then that number resets every January. This year, 2023, it's $226. So if you have a G plan, you would be out of pocket that first $226. You had the F plan, it covered the B deductible, but the G plan does not. And that takes us to the last plan I want to mention, and that's the N plan, and it covers 4 of the 6 gaps. So you would be responsible for the Part B deductible, and you'd be responsible for excess charges. So if a doctor adds that 15%, if you have the N plan, you would have to pay that 15%. And then you have some copays to a doctor up to $20 and copays to the emergency room up to $50. So the point is your premium is going to be a little bit lower. You're just taking on a little bit more risk. All right, so those are your Medigap policies. So what's happening is I have this system, Medicare pays first, my Medigap pays second. So as long as Medicare pays, that plan that you buy, that Medicare supplemental plan will fill in the gaps based upon the letter that you purchased. All right, so let's talk about how this looks financially for you. So what we're going to do, we're just going to look at the numbers real quickly. For most people, Medicare A is going to be 0 premium. As long as you or your spouse have paid into the Medicare tax system for at least 40 quarters, which is basically 10 years worth of work, Medicare A will be premium free for life. Now, Medicare B is not premium free. It's going to carry a premium. Now, right now, that premium for 2023 is $164.90 a month. If you're on Social Security, it comes out of your check. If not, they'll bill you for that quarterly, or you can set up some kind of an auto pay with Medicare to take that out monthly until you start your Social Security. Either way, we're going to pay for Part B. Now, this Part B premium is based upon what is called your modified adjusted gross income. Modified adjusted gross income. So if you're on Medicare in 2023, they looked at your modified adjusted gross income in 2021. Modified adjusted gross income is simply your adjusted gross income plus any tax-free or tax-exempt interest income. It's typically municipal bonds, some U.S. savings bonds, maybe foreign income, but you didn't pay taxes on that, but you still reported that on your return. And so they take your AGI, add that line for tax-exempt, tax-free interest income, and that becomes the number Medicare will use to determine what your Part B premium is going to be. So here's the way it works. We have a threshold. And so this year, 2023, if you're a single filer, the threshold is $97,000. $97,000. Okay, and if I'm below $97,000, I'm going to pay that $164.90 a month for my Part B premium. If you're above $97,000, you're going to pay more. Those are called IRMAs, income-related monthly adjusted amounts. Now, I'm not going to go into that on this video. I've got plenty of teaching about that. But if you're considered to be high income, above $97,000 as a single filer, you're going to pay an additional amount, and that ranges anywhere from about $75 upwards to about $500 a month, depending upon your modified adjusted gross income. Now, if you're a couple, married and file a joint return, that number is $194,000. As you can see, it's just simply doubled. So as long as you as a married couple file a joint return are below $194,000, each of you again would pay the $164.90. Okay, so that means we're enrolled in A and B, we're paying our Part B premium, and let's say we get an F plan. Now again, we're a nationwide company, so please, I'm just going to give you kind of a broad range, not specific, because this is going to vary drastically state to state. Okay, so I just want to get your kind of a feel for what these numbers are going to be for premiums. So on the F plan right now, you're going to be in the neighborhood of about $175 to about $200 a month for that F plan. And again, this is going to vary state to state, but that's a good range. A G plan's going to be anywhere from about $125 to $150 a month. And an N plan is going to be anywhere from about $90 a month to maybe $125 a month. It depends on the carrier and, of course, the state as well. F plan, full coverage, all 6 gaps covered. G plan, 5 of the 6 gaps. And then N plan, 4 of the 6 gaps, plus you have some copays as well. All right, now, what's important to note about this is in most states, and again, there's some exceptions, but in most states, you have to realize that when you make this decision, that decision is going to be pretty much a lifetime decision, because what happens is when you first start Medicare, you have this opportunity in every state that's 6 months of your B date. So if I have a B date, let's say of 1/1/2023, I have 6 months of that date, which would be what? January, February, March, April, May, June. Okay, and then July 1, 2023, in most states, if I would like to get a supplemental plan after 6 months of my B date, now I have to medically qualify to get that supplemental plan. Now, again, there are some exceptions. The state of Washington, Connecticut, Vermont, and New York, you can actually get a supplemental plan anytime you want. But all the other states, there's rules for getting these supplemental plans. And my point is, you have this window of opportunity when you first start your Medicare Part B, that last 6 months, and you can get any plan you want, regardless of health conditions, regardless of medication that you take, because the insurance companies have to write that policy. We call that a guaranteed issue period, and you do not want to miss out on that opportunity to get that supplemental plan if that's how you want to use your Medicare. So during those 6 months, they have to write the policy. Now, you don't have to wait till your Part B date begins to apply. We actually can apply for a Medicare supplemental plan anywhere from 3 to 6 months in advance, so that it will start right when our Medicare Part B begins as well. So that's called our open enrollment period, or a Medigap open enrollment period, also called your guaranteed issue right. So it's very important to understand that this is a time when that company has to issue the policy. And after 6 months, in most states, they don't have to do that. Now, to get a supplemental plan, you have to medically qualify. 30 health questions you have to answer. We look at all your medications, get a statement from your doctor. So there's that underwriting process that you don't have to worry about during the 6 months, but afterwards you could be subject to that. All right, so the whole point is, this is one system that is available to us when we decide to go on Medicare. All right, now let's look at the second system. And these plans are actually called Advantage plans. These are called C plans, Advantage plans. Now, these plans came into existence in right around 2003 under the second George Bush administration. And this is the second option, and they're called replacement plans because this is an alternative to the first system I just taught you about, A and B, alternative. You cannot have both. And the only thing that these two systems have in common is one item, and that is this. If I have a C plan, I've got to be enrolled in A and B. Again, A is 0 premium, and B is $164.90. And so to be eligible for an Advantage plan, I've got to be paying my Part B premium, got to be enrolled in A and B, and I have to live in that plan's particular service area, which is typically a metro area or maybe multi-county area within the state. But I'm going to have to be enrolled in A and B to qualify for my C plan. Now, the difference is, in that first system with original Medicare, we had our A and B card, Medicare pays first, and we had our supplemental card, F, G, or N, or whatever you buy. And so when I go to a provider, I give them my A and B card and my supplemental plan. The provider files a claim with Medicare, and then Medicare takes the balance and sends it automatically to my supplemental company that pays the bills out, less my out-of-pocket expenses, which would be, like on the G plan, the B deductible once a year. Then I'd be done. So whatever plan you buy, then you're going to be responsible for those out-of-pocket expenses. And then once you've paid that deductible, then you're done for the whole year. So that's that system. In this system, what happens is, yes, I'm enrolled in A and B, but you actually put your A and B card in storage because you're not going to use it, because that Advantage company is going to issue to you one card, and that is going to be for inpatient, outpatient, as well as prescription drugs, right? And so we have this one card system. So I go to the hospital, go to the doctor, I just simply give them my one card, and what's going to happen is this. Now what I'm going to do is I'm going to pay copays. And so when we talked about this potential of $10,000, that is a reality. There's plenty of people that have that happen. And the reason for that is, though I may be on an Advantage plan that actually has a 0 premium, meaning I don't have to pay the insurance company any money to be on that plan. I had to pay Medicare, remember, my $164.90 or more if I'm high income. But instead of paying a premium, now I'm going to pay copays. And so you pay copays. Now, there will be on every plan some copays that will be zero. You typically can go to your primary care physician at a zero copay. You can get usually some lab work at a zero copay. Preventive will be zero. And they'll throw lots of different perks in the plan. They'll give you some hearing aid allowance, some dental and vision allowance, gym membership, and all those things are typically going to be zero as well. So there's a few things that are zero. But 90% of the services you're going to get on the Advantage plan, you're going to be out of pocket something, and that is called the copays. And so if you go to a specialist, that specialist visit is going to cost you anywhere from about $35 to $50 every time you see a specialist, cardiologist, dermatologist, orthopedic doctor, wherever you go, $35 to $50. And then if you have to go to the hospital, you're going to have a copay. Okay, hospital copay right now on average is going to be about $325 a day. All right, so it's not crazy high, but it's $325 a day, and it's going to be anywhere from about usually 1 to 6 days, and then on the 7th day thereafter, it's going to be no cost. So every time I'm hospitalized, I'm responsible for a daily copay. All right, now let's say I have a CAT scan or an MRI or a PET scan, something like that. You're going to pay a copay for that. On the average, it's going to be about $200 or so per test. All right, so if someone has multiple tests, every time they have one of those, it's going to be $200. If someone goes to a skilled nursing facility, usually the first 20 days, there's no cost to you, and then after that, it's going to cost you about $200 a day to be in that skilled nursing facility. If someone has an outpatient surgery, they have a cataract surgery or maybe a knee replacement, something like that, they're going to pay a flat, very reasonable copay, usually about $250 for that surgery. So what I'm trying to teach you is that on Advantage plans, since we don't have a premium, what we're doing is we're paying as we go. So we pay copays instead. If I took that supplemental plan, what did I have out of pocket? Well, I pay a premium for the plan, but out of pocket, I only have my B deductible, $226 this year, and that's it. So I don't have anything else out of pocket. You can put your checkbook and your wallet away because you meet the B deductible. You're done. You have 100% coverage after that. With these plans, no premium, but again, I'm going to pay as I go. Now, here's what happens. Whenever you have an Advantage plan, you're going to be involved in a network. And this is one of the issues that you have to be comfortable with. And again, doesn't make these plans bad, but it's different than original Medicare A and B with a supplemental plan. Because if I have a supplemental plan, all I have to do is ask the provider I want to go to, the hospital, the doctor, do you take Medicare? Because if they take Medicare, they absolutely will take my supplemental plan of choice. Whatever company you've chosen, whatever letter you bought, they have to take that. All right, and so we don't have a network. As long as they take Medicare, go anywhere you want, and that's true for anywhere in the country. Okay, it's the same whether you pull that A and B and your G card out in Florida, you pull it out in Washington or Hawaii. It's all the same because it's a federal plan. Now, when it comes to Advantage plans, that's not the way it works. You absolutely are going to be in a network. It's either going to be an HMO or it's going to be a PPO. Now, there's a couple differences between these HMOs. They do not give you an out-of-network benefit unless it's an emergency or an urgent care situation. Urgent care, emergency, go anywhere you want. You're treated as though you're right in the network. But beyond that, if you're on an HMO plan, you have to stay in the network, which means what? You will absolutely be limited to the doctors and hospitals that you can choose from. That's just the way HMO plans work.
Hey, if you're looking for someone to help you hold your hand through this entire Medicare enrollment process, we would love to do that. Our team is standing by to help you. We help about 1,000 people a month go from Medicare confusion to having their plans enrolled, and it takes probably less than an hour. Go to the pinned comment below and you can book your appointment.
Now, PPO plans, what happens is they do let you go out of the network, but again, it's going to cost you more money to do that. So if I stay in my PPO network, which is larger than the HMO network, certainly not as large as Medicare network, but at least I have a few more options. But if I go out of network, maybe some kind of cancer center you want to go to or whatever, and they're out of the network, then it's going to cost you more money. All right. And so when we talk about someone easily, potentially spending $10,000 out of their pocket, it's because what happens is they pay as they go. And if they ever have to go out of the network, it's going to cost them substantially more. So here's the way it works. We call this a MOOP, a max out of pocket. Now, this MOOP has to do with inpatient and outpatient care. So if I'm on the HMO, I have to stay on my network. Those HMOs right now are going to range anywhere from about $2,500 to maybe $4,000 max out of pocket. Okay, and I'm talking about for the whole year. So again, copay, till I hit my max, and then I'm done. And then that max out of pocket resets every January, and then I'm back to copay until I hit my max. So right now, HMO is about $2,500 to $4,000. What's the negative? You've got to stay in your network unless it's urgent or emergency situation. Now, PPOs allow me to go out of the network as long as that provider takes Medicare, but here's what happens. HMOs right now, on average, are going to be about $5,000 annual max out of pocket if I stay in my network. But if I go out of my network to a certain hospital I want to go to, any cancer hospital that specializes in cancer treatment, even if they'll take it, but if they do take it, then you're out of the network. Mayo Clinic, certainly places like that, usually out of the network. And then they bump my max out of pocket to $10,000. So, and that's an in and out of network combined amount. So if someone gets cancer and they decide to get treated for it, chemotherapy, radiation, surgery, all the oncologists, all that is going to go into that particular care, you are going to max out at $10,000. So what happens is many people jump all over an Advantage plan because it has a zero premium and all these perks, but they don't realize that they're putting themselves at a tremendous amount of risk if they have some kind of a financial issue, as it relates to cancer treatment. All right, and so we have to be prepared for those kind of things. Agents don't talk about this. All the advertisements don't talk about this because they don't want you to realize it. And so the smart thing to do is not just look at the premium. The smart thing is to do is, what is this going to cost me if I had a serious health issue, something with my heart, maybe a cancer or some issue that really is going to require a lot of care? How much will it cost you? And again, very easily you could spend $5,000 to $10,000 on those Advantage plans. So let's compare it. If I had my A and B with my G plan, we know that the B is going to be that $164.90 a month. Obviously, that's going to be $1,900. We just round that up. Let's just call it $1,980 for the whole year. And let's say my G plan is $125 a month. And again, it's going to vary around the country, but times 12, that's going to give us premiums of, what is that, $1,500, okay, for the whole year. So I spent $1,980, I spent $1,500, so I'm at, I'm at $3,480 out of pocket for my cancer, and I had that small B deductible, which is what, $226 for the whole year. So I'm spending now about, about a little over $3,700 for that cancer treatment. And again, the beauty is I can go anywhere I want. I don't have pre-authorizations to deal with whatsoever, because if Medicare pays, the supplemental plan will pay. And so I'm going to be out of pocket about $3,700 on that particular plan, right? Now, if I take the Advantage plan, what happens? On the Advantage plan, again, I had my $1,980 because I still had to pay for Part B, but I had no premium like I had over here. But instead, I'm paying copays as I go. And so if I stay in my network on my HMO, what am I going to be out of pocket? Anywhere from about $2,500 to $4,000. If I'm on PPO, I stay in my network, I'm going to be about $5,000, but if I go out of network, I'm going to be at $10,000, okay? So if I had a serious illness, which one of these systems am I going to spend more money on? It's very clear. Even if I have an HMO that's very low cost, $2,500, I still got about $2,000 I paid for my Part B. So over here, I still spent $4,500, but I was also bound to an HMO network. On my PPO, if I went on network, now I got $10,000 plus my $1,980. So I spent about $12,000 to be on that Advantage plan. Yes, it had some very attractive perks that were included at zero premium, but at the end of the day, did you really get anything out of that plan if you have some kind of a serious illness? And that's what you've got to look at to make sure you know, if I get sick, what is this going to cost me? And again, there's stats all over the place. You can find it online where someone that has even an average hospital stay will spend more money on their Advantage plan all year long than they would paying for a premium all year long on their supplemental plan. Okay, but secondly, they also, with Advantage plans, have what's called pre-authorizations. And this is a big deal. When you're on an Advantage plan, that Advantage plan actually has the final say-so for any healthcare services that you need. Now, we can go to the doctor, we can go to a specialist, we can get labs without any pre-authorization. But I can assure you, if you're going to have any kind of surgery, a hospital stay, outpatient situation, MRIs or CAT scans, all that has to be pre-approved. And sometimes they deny those pre-authorizations. They say, no, we don't think you need this. Or they delay the coverage, and we have to wait 2 to 4, 6 weeks before we get approval. And so you never deal with pre-authorizations in the Medicare supplemental system. If Medicare pays, supplemental plan pays, they have no say-so. Here, the Advantage plan actually has the final say-so for all your healthcare services. And then lastly, what can happen, and I'll be done with this, if you go on an Advantage plan and you stay on that Advantage plan for a year or longer, if you ever want to get off of it, in most states, now you got to medically qualify to get that supplemental plan, okay? And so that becomes an issue. So if we have some serious health issues, you may never be able to get off of that Medicare Advantage plan. You'll have to stay in that system with networks and pre-authorizations and pay as you go. All right, and so listen, it doesn't mean that the Advantage plan is bad, but I'm sharing this with you because when you see the ads, it's almost like, well, why wouldn't I do this? Well, I tell you why you wouldn't want to do it. If you had a serious health issue, you will spend more money out of pocket on that Advantage plan than you're going to with that supplemental plan. Okay, just want to read this quick letter to you, and we'll conclude the video. This came to me just about a month or so ago, and a guy writes out about a situation that he experienced back in 2021. Here's what he says. He says, I was healthy as a horse in September 2021 when some stomach issues prompted me to get some lab work. The lab called me and said my liver enzymes were way off and that I needed to go to the emergency room immediately. I soon learned that I had a very early stages of pancreatic cancer. An aborted surgery because of pancreatitis left me at KU Med Center for most of the month of October. Again, this was a year ago. He says, I left the hospital with a walker, 3 drain tubes, and a feeding line. Absolutely lucky I was alive, although still with the cancer. Following 6 months of chemotherapy, I elected for a second opinion and had the cancer removed in late June by a surgeon at Mayo Clinic in Jacksonville. He says, I don't know how many ER visits I had, hospital stays, CAT scans, MRIs during this period of time, but I know that I have had a minimum out-of-pocket cost and absolutely no problems getting anything approved. In addition, I have the peace of mind from knowing that the surgeon who does more of the Whipple surgeries than any other doctor in the U.S. performed my surgery. I have thought and wanted to write to express my thanks to you for recommending regular Medicare and not an Advantage plan. Even though I would have thought that the Advantage plan would have been a better deal for someone with my good health, I was just very fortunate to have followed your recommendation. While I cannot give high praise for some of the doctors at KU Med, I can say that my experience with insurance coverage could not have been better. And so the point is, getting cancer, those two systems are going to look totally different, and you have to decide. And he's just simply saying, I was glad I stayed in original Medicare with the supplemental plan. He had a G plan because no pre-approvals. He was out of pocket very little money other than his premium he pays and his once a year B deductible. So we're not just going to look at the ads where they talk about all the advantages of the Advantage plan. We have to realize there are some disadvantages to them as well, especially for those of you that would have a serious illness, potentially up to $10,000 or more. Thanks so much.